Welcome to my channel. My name is Marisa and this is Colin Jr. It's my little 5.5-month-old baby. I am a pediatric nurse, so that kind of ties in a lot with babies. What I wish I knew before starting nursing school. Number 1. You have a high chance of failing and repeating a grade. Nursing school is very, very challenging. As far as like having to repeat a class or like failing at some point, it's pretty common. I know a lot of people that have been through that, especially at my school, unfortunately. And I had even had to repeat a semester before too. So on top of that, it's very demanding of all areas of your life. You're usually having to spend so much time studying. Your whole world is absorbed in nursing school, and you just, sometimes if other things are going on in your life that are taking your mind away from that, that's another big thing that can be challenging when you are trying to pass and be completely absorbed in it. So just keep that in mind. If you are going to nursing school, you know, even though it's a 2-year program, there's a chance that it could take a little bit longer. You never know. Some people get through it right away and some people don't. When you first start, especially the first semester, is really hard for people. Getting used to testing and the workload takes a little bit of time. So a lot of times people will have to repeat like that first class or that first semester. And then the amount that you study does not always save you. So the way that they test in nursing is a lot of critical thinking. You could memorize every single thing that they told you, everything that's in the book, but if you don't know how to analyze or critically think how you would approach a certain situation that they present to you in a nursing question, you can do very badly on exams. And that's what makes it so hard. It takes a lot of getting used to how to think the way they want you to think, and it takes, you know, it's a lot. If you have anything else going on in your life, like, it's very demanding, and, you know, don't be so hard on yourself. You're not alone, trust me. 2, what I wish I knew before starting nursing school. How much you have to practice goes into knowing how to answer questions. So kind of tying into the first part, I didn't realize, just like, you know, you think, oh, I'm gonna study like I did for my anatomy and biology class and everything will be fine because I worked really hard and I got A's, ta-da! And then you get to nursing school and you're hit with these like crazy questions and you just don't even know how to like approach them. So basically, I didn't realize that I have to practice nclex style questions. Hi, little boy. And so that's something I didn't really realize in the beginning. Watch videos on how to answer nclex questions before you start. I will link a couple videos that were very, very helpful for me. Okay. 3, making the right friends matters. So I remember when I first went into nursing school, I was like, you know what? I'm not gonna worry about being social. I'm not gonna worry about making friends. I just wanna focus on getting through this because it bettering our lives was like a huge part of it. And, you know, I just knew like we really needed this. We were struggling. We wanted to start a family, but we didn't want to start one without a secure income. So I was like totally zoned in that way. And I think that's why in my first semester, I really, really struggled, because nursing school, you are stronger together. Nobody can understand what you're going through except for the people that are going through it with you. And so it's really strong. I mean, it's really important to like make those connections. You can also like learn so much from other people that you didn't even realize. Like I've had friends that were like, oh, check this website out or watch this video, it's helped me out so much. And I'll be like, oh my god, like I'm so glad that I saw this, because it like opened my eyes to seeing the topic totally different, or I understood things so much better. Then you also have moral and emotional support. So like when you're having a really bad day or you're just feeling like defeated, you can go to those people and just be like, just vent, and they like totally get it, and it just helps. It helps you get through it. So make sure you make friends, and it might take a little bit to scope out the ones that are kind of in sync with your goals. And yeah. Number 4, you really don't have free time. This one might kind of be obvious, but just in case, a lot of people think that you'll still be able to maintain certain things in your life, and probably not. Depending on how you are now with, I don't know, social or what kind of, how you manage your life, you'll have to make a lot of sacrifices. You won't be able to do a lot of like social events outside of your nursing friends. You probably won't have time to keep your house super clean like you keep it now. Family time, which is really hard when you have kids. Like I know people that went through nursing school that had kids, and now that I have one, I can imagine how heartbreaking it must be to say, hey, I can't spend time with you. I need to go sit down at this desk and stare at a computer and study. So the workload is intense and complex. A lot of family members don't understand that because they're not going through it with you, which is another tie into the friends that you can just have support that know what you're going through. 5, not all nurses are great nurses. Not all professors are great professors. So I think what happens to a lot of people, or at least it happened to me, when you pick the nursing profession, you create this moment. Just look up to nurses so much, and you're like, you know how hard it is, especially in the beginning of nursing school, and you're like, wow, this person went through all this, and they must be so smart and so good at what they do, and just all that kind of stuff. And then you go to the hospitals and you get paired up with a nurse who just sucks, who's just cutting corners, or who's just kind of treating patients crappy, or who just has an attitude of, oh, whatever, this is fine, go ahead, or it doesn't matter, or blah blah. And you're just like, wait a minute. How did you go through everything that I'm trying to go through and get to this point and have this type of attitude? Not all nurses are your Florence Nightingale. The other aspect of that is a lot of your professors will kind of suck. Like at my school, we had our like core faculty professors that would do clinicals, and then they would hire part-time clinical professors that weren't a part of the like core faculty, and would just like be there to be able to take you on your Saturday clinical and go through your skills, and that's it. And a lot of times those teachers weren't as like skilled as your clinical professors. They may know the book aspect of it and the NCLEX aspect of it, but the whole real world, like this is how you got to get it done type of nursing aspect, they're a little bit out of touch with. As far as like teachers go, it's important to, you basically kind of have to adapt to what your teacher wants. Like for example, I had this one teacher who was really like anal about certain things. If our paper had to be in a certain order and it had to be paper clipped, not stapled. So when you're in school, you kind of have to like, that might not be how you handle things when you graduate, but you have to do whatever they want you to do, whether it's realistic or not, in the real world of nursing. Number 6, clinical can be boring. I remember when I first got into nursing school and I got my uniform, and after we did the stupid orientation clinical and we were gonna go to the hospital, I just remember being so excited, and I was like, all right, I want to like, you know, I want to see the blood and the guts. I want to really get my hands dirty, get in there, like do the skills, like see the sick patients. Sounds terrible, but you're just like super into the medical aspect, you know, you watch the Grey's Anatomy and all that, and then you get there and half the time you're doing vitals and then you're just kind of standing around because you only have one patient, and maybe your patient was like post-op for a knee surgery, or and yeah, you have your certain things that you have to follow. You're checking your eyes and nose, but not really that much going on with that patient, and you're just kind of, maybe you got to put them on fluids, and that's the highlight of your day, and then the rest of it, it's like, okay, and you're just kind of like, so it can be a little bit boring a lot of times, at least my experience. I don't know how other schools in different parts of the country work, but a lot of times you're paired up with a teacher. Like, we had like 1 teacher to 8 students, so we're kind of just like standing around waiting to give our meds, while the teacher's helping some of the other students. And yeah, you just kind of hang out, and you think you're gonna be like super busy all the time, and most of the time you're not. What I would recommend to anybody who is going to nursing school, maybe later in your semesters after you've got a good grounding of like your schoolwork and can balance stuff, is finding a job as a nurse tech. It's not the same as a patient care technician or anything like that, because the hospital is hiring you with the intention that you are in nursing school. You will graduate and you could possibly work as a registered nurse at their hospital. And so a lot of times they will pair you up with a nurse, and that nurse will like have you do skills, or you'll get to watch more skills, or get to the bad thing about clinical is that you're not seeing the flow of being a nurse. So you only have one patient. You're not taking on the whole care of the patient that you have, because it's just not realistic for you to be able to do that. And then when you work as a nurse tech and you get paired with a nurse, you're following that nurse through her whole entire day. You're seeing her, how it evolves. You're seeing her answer phone calls, taking new orders. Maybe a patient starts declining a little bit more, so now that patient needs a little bit more attention. Now you're getting new meds. You're gonna pull fluids for them. Their blood pressure is low. We got to do a fluid bolus. Let's go take care of that. You know what I mean? Like, oh, they don't have an IV. We got to get IV access. And just on top of that, I love prioritizing your care. You got your morning meds. You got 30 morning meds you got to give. Who's the most important ones? Maybe your patients that are known to have seizures. You want to make sure they get their seizure meds on time. Maybe you have rehab patients that go down to rehab at 9-10 o'clock in the morning, and who have feeds that go through their G-tube. So you got to get those patients taken care of first too. And kind of goes through your whole day, and then you kind of see where it levels off, and you have time to chart, and then you got to go around again on all your patients. This is mostly med surg. I'm sure it's a whole different, basically there's a flow for every type of category. ER nursing probably has their way of a flow. ICU has their flow, and you can kind of see how people manage it and get through it, because it takes a little practice and time management, and it's just very helpful to get that rhythm and see how it works. And a lot of times, if you show up to the same unit a lot and you get to know the nurses, you get confident in certain skills like taking out IVs, or hooking a patient up to their G-tube feed and starting a feed. The nurse might be like, hey, go do this for me, or go do that for me. And you kind of have a little bit of autonomy and get that nice feeling of being like, yeah, okay, I'm a nurse, and this is part of the task. And just like owning the role a little bit more. So I would always recommend go be a nurse tech. All right, those were my top 6 what I wish I knew before I started nursing school. If you're in nursing school right now, keep plugging through. There's a lot of negativity in the field, especially since COVID and everything. And I'm not gonna lie, it can be hard. It's intense. You have days where you're like, I wish that I picked something else. Maybe you're on a unit that's not working out for you. You can always switch to something else. There's so many different things nurses can do. Don't give up on it. It is a very secure career. There is a lot of gratification for it. When you have those special moments with patients and you make those special connections, or you really do your best to take care of a patient, and shows them, they show progression, or you catch something that could have been really bad, and you bring it to the attention of the doctors, and now this patient's going in the right direction instead of possibly going in a bad direction. Those are all the things that make it worth it, on top of just being a very high-paced, stimulating job, and it can be very gratifying. You definitely have the hard times and the good times, but good luck to you, and welcome to the world of nursing. And if you have any questions or any advice or whatever input you want to do, leave it in the comments. And if you like this video, give me a thumbs up. Hope to see you in the next one. Bye.